Okay. So so everyone knows what Moxy is. We're very fortunate because I've been working with Sciton, and these devices are made by Sciton. I've been working for Sciton with them since they started. So I've been involved with them since 1998, and they started in late 97. So I'm like the oldest person who's been working with them. And we went from a point where these companies just made lasers and they gave them to you, you bought them. I bought my first couple and I still buy for the other offices. But we kind of graduated over the years to being able to do all the R&D. And many laser companies just give doctors lasers and they say, okay, here, just play with it and here's the settings and do what you want with it. But we have a very unique position for Sciton in that we're involved in all of their R&D calls. So they actually ask us what we need, what we use. They come to our office, and then when they build devices, we get them way before anybody else does. And sometimes they work and sometimes there are problems. So Moxy came out during COVID, and we had one of the first pre-production boxes. And one of the things they asked us for was to work out the kinks with it. So Moxy is classified as a non-ablative fractional laser, which means that it punches little holes in the skin and it's kind of creates an area of dead skin. That's a non-ablative fractional laser. And I always consider Moxy as a pigment laser. It doesn't go too deep. The max depth you got from this original Moxy was 200 microns, which is about two post-it notes or two sheets of paper. And the outer layer of your skin, called the epidermis, is about 100 microns. So the first generation Moxy, it went down max 200 microns and max density of 20%. That means that if you think of cleats on a golf course and each cleat is a hole, if you had cleats that went across the whole golf course, that would be 100%. But the maximum Moxie did was 20%. So that means 80% were left untreated, which it gave you a very nice recovery. It was for pigment, it was for all skin types. And I've probably had 20, 30 of these myself. And I used to do a lot of them with at the shows with no numbing just for play. But it's a wonderful, wonderful device. We still have it, but we've moved a little bit. And this is just another example of Moxie. Gets you pigment, it gets a little bit of pores, a little color. But the beauty of Moxie was that you could use it on all different skin types. So this is an Asian patient. You can see how it glowed. You got a glow from Moxie. And even on lighter, even on darker skin black patients or lighter skin black patients, I mean, it's pretty rare to see lasers done on black people, but black people usually don't get wrinkles; they get pigment. So this is a great treatment. I treated her, her sister, and her mother on the same day. They're good friends of ours, and you can see how nice she is. It just glowed. It makes her look fresher. Doesn't make her look different, just makes her look fresher. And basically zero downtime with this level Moxie that she had, like literally zero. I had a bunch of these and then I went out the same day. I might have looked like I had been out in the sun for 10 minutes, but very minor. And Halo is what everyone's heard about. Halo's been out around, 12, 13 years. And as with Moxie, we were involved with the development of Halo. We had a lot of the pre-production units, which look like a computer on a platform. And with Halo, it goes a little bit deeper. And you're looking for texture, you're looking for some pigment, and a little bit more downtime than the Moxie. So this is an example of Halo. And you can see great treatment, one treatment. I didn't like to sell packages. I just like to do one. But you can see she's polished, looks a little bit better, but it goes deeper. And here's a guy, a little more aggressive treatment. So he did pretty well. And when you compare Halo to Moxie, think about it. Halo goes deeper. The densities could go up a little bit on the Halo. You can put them a little closer together. But in general, if Moxie gave you a 0 to 1 day downtime, Halo might have given you a 3 day downtime. But it all depends on the depths and the densities. The deeper you go and the closer the spots are together, the more the healing time. And Halo went after texture, went after acne scars, and it went after overall appearance of skin, where Moxie was more polishing. But from a laser company perspective, the Moxie was only available on their small box, and the Halo was only available on their bigger box. And they wanted to make Moxie more available for everybody. So I was involved with a lot of discussions on how to build this and what to put in. And I really pushed to have some differences between the upgraded device and the existing device. and this is called Halo Tribrid. They're so back ordered. I don't even have the upgraded handpiece for it, which has nice colors in it. I have a ghetto handpiece that looks like it's 3D printed, held together with tape. Still works, but I'm waiting for my ones with the nice colors in it. So what they basically did was they put Halo and Moxy together in one handpiece. And if you look at this slide, these are the examples of these non-ablative lesions. They're not in the same spots. The Halo has two wavelengths of light, and they're mostly in the same spot. But the Moxies are adjacent spots, and they did a lot of time working on this to make sure that based on the computer algorithms, these spots didn't land in the same holes. They landed in different holes. So they spent a lot of R&D time. I mean, must have put 50, 100 hours of time in just on calls talking about this technology. Well, these are the two together. And the advantage of this for the practitioner, and this some of these slides are meant a little bit for the staff treating them, but when you look at this, there's lots of different things you can do with this device. So you can still do Halo, you can still do Moxy, no problem. See my cursor here. You can put them all together, and that's called Tribrid. You could also do Moxy plus erbium, which is we never were able to do that. We were able to do Moxy and Halo without the erbium. We couldn't do that before. And we could also just run erbium off of it. So there's a lot of things that we can run off of it that we couldn't run it before. I'm mostly doing Tribrid, and even if someone wants a Moxy, a lot of times I'll just do Moxy, or I'm doing a lighter, can do a lighter Tribrid and just turning down things. But the advantages of when we set these lasers, and if you see us in the office messing with the numbers, they're different depths. So this is the depth. So the top two are Halo and the bottom one's Moxy. So these are the same depths as the previous Halo, but it's about twice as fast as the previous Halo. But the Moxy, instead of doing 20 millijoules, which is 200 microns and 20% density, it now goes to 40 millijoules, which is 400 microns and 40% density. So they double the depth and double the density. So you could do a way more aggressive Moxy treatment. And then basically what you want to see with this is total coverage, which is forget the erbium. You just add up the coverage of the Halo here and add up the coverage of the Moxy here, and that tells you total coverage. If you keep the coverage low, it's a quick recovery, and this gives us the beauty of keeping the coverage high and doing a full peel, which is really cool, which we couldn't do with the previous technology. So if you just have some pigment, we have settings for pigment. If you have a little texture, we can do that. But if you have really crappy skin and you want us to go to town on you, we have the advantage to do that. Like I did one today. I actually turned off the erbium and I did a little peel on top of it. So lots of different things. So this is an example of Tribrid, all three. This is a mild one. And if you want to look at the density, it's 10% Halo and 15% Moxy. So that's 25%. But vary within a couple of reasons. This is like a weekend. Get this on a Friday, by Monday you're fine. And you can see a close up, and she's darker skin. You can really see that you can see that her texture improved and her color improved and all these little spots improved, and she has a really wonderful glow. So that's an amazing result for just a couple of days of downtime. And here's another patient. You can see some of the spots are gone and some of the texture is better. And you see the close up. So some of the wrinkles are better. It filled out this, but the texture is better. And you can see a lot of the lines are better. Now, if she wanted all of this gone, I would do what's called the TRL, and that's a full resurfacing laser. But that's not what most of these patients who want Tribrid come in for. So if you look at this, her healing time and this, which is 45% density, was probably about 5 days. Not too bad. That's her again. And here's an older lady. And, if she came into my clinic and asked me what I would recommend besides a facelift, I would do a really aggressive laser. But again, a lot of people work. A lot of people don't have time for a really aggressive laser. So these aggressive tribrids fill a spot between like regular Halo and Moxy and a super deep resurfacing. So where a deep resurfacing might take a week to heal and might take a couple of weeks for the redness to go away, with all of these tribrids, you look pretty good at a week. And you're pretty good by 4 or 5 days, depending on the settings, but by a week, you're great. And this is a pretty aggressive one. And you can see like she's pretty wrinkled up and she did really well with this. And these are done by my friend Sharif. And here's another, that's actually Sharif's wife, I believe, and she's Asian. You can see that we use this on all skin types. and she had like 25% density. It's not too bad, not too aggressive. She's probably healed in 48 hours. So nice result, especially for someone looking to get rid of some spots and polishing. But it gives you a little bit more than Halo would give you, and it definitely gives you more than Moxy would give you. So very nice, a very nice result in this patient. You can see, and from what I remember, he was telling us on stage, this brown spot was driving his wife crazy, and she's like, "I'm the wife of a dermatologist. I can't be going around with a brown spot like that." So, and it was pretty deep. So sometimes these superficial pigment did well with Moxy, but sometimes they were a little deeper, and that's where the combination of Halo and Moxy together in one handpiece gets rid of a lot of these brown spots. Here's another one. You can see the pigment and the texture are good. A couple of days of downtime, but really nice result. And when I say downtime, I'm talking about you can go out to a party, you may not be ready to go to your daughter's wedding right away, but at 4 or 5 days, most of the people are out and about. And you're usually not really red with this, so you don't need makeup covering it. And all of these patients that we're talking about were just done with numbing cream. So patients comes in, gets numbing cream for half an hour. If they're kind of wussy, that we could give them Pronox, which is nitrous oxide to suck on, but you don't really need that. Just topical numbing is good. We wipe the numbing off, and then we go to town with the laser. It's not just for women. You can see some of the redness gets better, some of the texture gets better. Thought he did pretty well with this. Um, nice improvement. Here's another one. You can see the pores. This is a great laser for pores. I wrote a paper with Dr. Rob on Halo for pores, and we found out that Moxy did pores, but the combination Tribrid does pores even better. And you can see his forehead with same patient. And here's one that's a really aggressive one where they added BBL heroic to Tribrid. So you can see that this really sun damaged patient had a very aggressive hero and the 40% density Tribrid. So pretty aggressive on both ends. And I would say about 5-day recovery for this patient. And really remarkable result. And you can see the lines around the eyes got better, and the pigment got better, and the texture got better. So here's one of my patients. She's in her early 70s, and I would love to do a facelift on her, and she wasn't ready. And I would love to do a deeper surfacing on her, but she didn't have the downtime for that. So she says, do something to me that's really going to get me peeled, but really get me healed pretty quickly. And there she is on day 4. I did a full peel on her, and all this is all like dead skin just coming off. So obviously by day 4, she's not ready to go out and about. But I can say that she was fully healed and looked great by 1 week. So 3 more days after this, she did great. And there she is 2 weeks later. So if you look at these patients post 2 weeks, they don't have the same redness or healing that we saw with a lot of deep resurfacing patients. So she's 2 weeks out, she's thrilled, and she's super happy. So this guy got some scars because I was testing another laser that we were developing for this company, and we worked out all the kinks, and this laser's not out yet. But this is a new tightening laser. But I was the first to try it. I tried it on myself, and we learned with this particular laser that you really need to cool the skin. And since we were cooling the skin, we've had zero problems, but we learned on me and I got some scars. So I said, okay, I waited a bit of time and I waited for Tribrid to come out. And I did a very aggressive Tribrid on myself. And we have this new device in the practice called the Visia CR, and that stands for clinical research. It's for pictures. And they really wanted to see how this would look with the Visia CR. And they really wanted me to look and see and get a healing diary. Just for note, I cropped out the neck, but I also did this laser coring on the neck, which is not yet out, but we've been doing it for about 3 or 4 years. And we do have that commercially available. It'll be out for the rest of the world probably in January or February, but I can't hide facelift scars. So I treated my neck with the coring and I did my face with the Tribrid. And you can see that we did topical. I did not do an MKO melt or any other oral agents for anything, and I just did topical. I didn't do Pronox. And you can see I went to work the next day. Actually, it's funny because I did this on a Monday night, and I picked the only person in the practice who was free that day, and that was Tanya. Tanya is one of our newer PAs. She was a medical assistant with us, and then she got her PA license, and she had never touched this laser before, and I was training her how to do it. So the first one she did was me, and the second one she did was her mother. But I've trained Carolyn, and I've trained the other doctors in the office and Liz to do this procedure. So pretty much any provider in our office is excellent. And I chose Tanya to do this only because she was the only one free that day, and I wanted it done at a certain time. So, I trained her on me, and I did this on a Monday, and you can see the pre. I was wrapped up Tuesday morning while I still had a little dressing on for my neck. I was on my Peloton. Then I got in the shower and shaved and went to work. And I think I had more interest in any lasers that week than any other time in my practice because everyone saw me healing. And you can see by a week, I had a little bit of healing still here because that was a pretty bad scar that I had up here. But this is 2 weeks. I'm almost 3 weeks out, and you can see the scars look a lot better, and my skin looks a shitload better. And I really think that these scars are almost going to go away with this. If you guys don't follow us, this is my friend Dr. DiBernardo. He's a plastic surgeon in New Jersey. If you're on Instagram, follow us because we put a lot of cool stuff that's not out yet. So this is where we kind of talk about what we see at meetings and a lot of new stuff. We actually also have our practice Instagram, but this is like new technology stuff that we put on quite a bit for all the companies. So thank you for that. And unless she has the video ready, I think we can take questions. You have the video, Kat, or no?
I have the doctor here to help me, and Colin said he thinks he knows what I was doing wrong. So let's see if he can get
Okay,
it
let's
pulled up
try it
for
again.
me.
So we were going to do the video first, then the slide deck, but
Start it over. All right, moment of truth. Let's see if Colin can do it for me.
yep, we hear it.
Yes.
Yep.
This video is 5 minutes long, so pretty quick.
I'll play with my bird.
Hey guys, I'm Jason Pozner, and this is Brittany. She actually works in our Fort Lauderdale office, and today she's actually the patients that are working for us, and she's going to get a Tribrid. So, let's talk to Brittany a little bit, okay? What is some of your concerns? Your skin doesn't look too bad, but tell me what's bothering you.
I would say mostly hyperpigmentation in certain areas, as well as fine lines and wrinkles along my jowls and my marionette lines.
Okay, so I'm going to put my glasses on. I'm going to look a little closer with my loupes on, and then we'll turn on the laser. So she has been numb, so she might be a little red from the numbing already. So I see. How old are you?
40.
40. Okay, so you're young, but I see some fine lines in here. Okay, definitely. I see some, a little bit of pores, fine lines. I really don't see any acne scarring. Do you have more melasma in here, or is it more just a little superficial pigment?
Superficial pigment, like sun damage.
So not hormones, because the settings would change a little bit if we were more melasma. And a couple of little pits in here. So you're a really good candidate for this. So I think you're going to really enjoy this. So with this laser, it's for a lot of different skin types. If someone is all skin types, from the lightest of the light skin to darkest of the darker patients, and then for different problems. So if you have some pigment, if you have some pores, texture, a lot of photo damage, you can turn it down or you can turn it up depending on what your problems are. What this laser is it's actually a new laser from Sciton. It's called Tribrid, and it is a combination of Halo and Moxy. So Halo's been around for about 12 years. Moxy's been around for about 4 years. And sort of like chocolate and peanut butter together to get Reese's peanut butter cups, it's putting them together. Now, in the past, we used to stack these technologies for the right patients, but this is an advantage over stacking because it offers different settings. The Halo component is much faster than the previous Halo, and then the 1927 or the Moxy component is way more powerful than the previous component. And then it also has another little bells and whistles in here that I could do certain things like Moxy or fractional together, or just all three together, or you can mix and match. So today we're going to do Tribrid, which is mixing Halo, which is 1470, erbium at 2940, and then the 1927 thulium type wavelength. So we're doing multi-layer approach to get rid of some of the pigments, of the texture, and some of the lines, and I can turn it up or down depending on your downtime.
And this was pretty quick. I expect this to take about maximum 15 minutes.
And as I said, if the patient's a little nervous Nelly or they're having low pain threshold, sometimes you give them promos.
Sheets every time with the sheet size, and it's amazing. Look how much dead skin is on there. That's all dead skin. So we wipe it off, okay? Nice and shiny again. And these are obviously disposable per hand, per patient. And I'm going to switch over to the other side. And I'm going to do the arm.
And she's blowing cold air with the other hand. And see, I don't have our new pretty handpiece yet. I have the ghetto 3D printed one.
Procedure. It took 12 minutes. Now, what's this? What's your pain level now? 1 to 10. It's a little burning afterwards usually.
I'd say about a 5. Not
Okay, 5. Now, what's this? This is the. So what's this? So she felt like a 3 while we were doing it. Not bad. Tolerate. Didn't move at all. Says it's about a 5. It usually burns a little bit. This is a Velez mask. We put these on after everybody. We put this on after the Tribrid, the Halos, and the Moxys. All right, what's your pain level now?
0.
0. Okay, so like it burns a little bit, and you put this mask on, and it takes it to a 0. It takes all the
It's
burning
water
away.
in the mask, nothing else.
The skin
No chemicals.
out of here. This warms up a little bit, but we use this on all the Halos, Moxys, and Tribrid. So really, it's a almost painless procedure. The recovery time is just a couple of days, and by next week, she's gonna have beautiful new skin.
And you can see that her social downtime was almost nothing. Okay, I'm glad you got it working, Kat.
Yes, me too. Thank you. And can you see
Uh,
Q&As? If anyone else would like to submit questions to Dr. Posner, we're going to run through some right now.
This is a really good question. 2 people asking about body. Yes, I treated someone arm the other day, and that's the push with this. We started with face, and we're really doing whole bodies with this now, especially in combination with heroic. So it's not going to tighten up like really wrinkled arm skin. You might get a little bit. We do have another technology that from the same company that I should be getting within the next month, which I have really high hopes for wrinkled arm skin. But for textural improvements off the face, absolutely, definitely. And we're working on the settings now. We don't have it dialed in perfectly well, but we can do a good job. Any other questions, anybody?
It looks like someone added one about injectables with the
Yeah,
tri.
nothing. No, it doesn't go deep enough. Doesn't touch your boat. I probably wouldn't do this the same day you get Botox, the same day, but 48 hours later, you're fine. And this will not mess with any of your toxins and fillers. Really good question, because we get that a lot. These lasers don't go deep enough to mess with your toxins and fillers. And if you had a facelift, I'd probably wait a month or so to get this done after a facelift. But you could do it a week before a facelift, no problem. But nice device. One of the ones that we've seen that's really, really slick. I don't want to use the Halo or Moxy anymore. So, but it's really fun. It's reasonably priced, and Kat could talk about discount for the people who are on this webinar.
Yes, for any of you who are attending the webinar, when you book a Tribrid at Sanctuary, you're going to get a complimentary neck treatment. Just how Dr. Posner said, it's great to do face, neck, I mean, anywhere on the body, just so you have that seamless head to toe look rather than your face being completely clear. And then especially in Florida, your neck looks like crap. So that's something that we're doing for webinar attendees.
Yeah, and I think our usual pricing is $2,500 for the face for this. I think it's an extra $1,000 for the neck. So you're basically saving $1,000 by being on the webinar. If you get free neck.
And someone wants to know, Dr. Posner, about a series of treatments or how often they should get
I don't
one.
think you need a series. It depends how bad your skin is. I just say do one, see what happens. You want to come in once a year, great. But I think most people are on somewhat of a budget, and you might need a laser, you might need fillers, you might need toxin, you might need a new pair of shoes. So I think you have to really address the patient's concerns. So a lot of these clinics, I see a lot of these med spas like to sell packages of crap. Do 10 of these and it's not going to do anything. I really will not sell packages of these because I think one treatment will be enough for most patients. Do one, see how you do. You can always do another one in a month or two, but um, I think we've treated one person twice, and the only time we'll do series is for acne scars. If you have bad acne scars, you'll definitely need a couple of these. And then you would treat. We just treated Cassandra. Dr. Riccio treated Cassandra yesterday with her second for some acne scarring. She's one of our estheticians. So if you saw her in the office this week, she was peeling because he cooked her. He put her on max settings for this, so she looked great. Anybody else? Oh, good question from Miss Oakland. What kind of post-op care? Nothing really. You might want to use Aquaphor for one day, but your wounds are healed the next day. It's not like you did a big aggressive laser where you're worried about healing. So no, I used after mine, I started using Elastin Nectar. Think that's a really good product. So I started using that on the first day. The first day, I didn't put anything on it the first day. But then I took my neck dressing off from coring, and I took a shower and I put elastin nectar on day two, and I used it for about a week, and then I forgot about it.
Yeah, the skin nectar is the best. I always liked using those after my
Yeah.
lasers.
So the elastin products are good. We have a lot of good products, and that's why we have a lot of estheticians in the practice. We have three. We have three excellent estheticians, and their job is to read the skin and come up with the appropriate therapy. Because we use different things depending on your skin type. Are you oily? Are you dry? Do you have a lot of pigment? Do you break out a lot? So we tend to adjust things. There's no cookie cutter way of doing it. And all three of our girls, Cassandra, Tina, and Cheryl in the med spa are very, very experienced. And as is Gail, Gail does a lot of the body treatments with the other technologies now too. So I mean, really, they're wonderful and very, very experienced. So they know what they're doing. And most of the time, when people ask me about skincare, I defer to them. Pretty much all the time.
Well, if
Okay.
anyone doesn't have any other questions, we appreciate you being here, Dr.
Right.
Posner, and dealing with our technical difficulties. It looks like Martine actually just asked for a last question with the BBL.
Sure.
That was one of the photos you showed
Yeah, you could. You
too.
could do BBL. In the beginning, whenever we get a new technology, we tend to use it alone, just because we want to prove that we're not confounding the results from one device or another device. But it depends on what your skin is. If you have a lot of pigment, yeah, it's a great thing to do it together. But I've been playing with like really aggressive settings because I like the really peeling. But especially for a lot of spots and sun damage, it's a great combo to do it together. Like today, I did
Definitely.
one. I did a Tribrid plus plus TRL today, which is a really aggressive laser. So I tightened up
Oof.
her eyes with the TRL, and they did TRL on her mouth and Tribrid on the rest of the face. So we have a lot of devices you can mix and match. And I think the best thing is just, you're not going to see a lot of this on the internet right now because it's too new. This device was introduced. They first offered it for sale September 3rd. So like 6 weeks ago, but we've had it since March for testing. And this was one of the few devices that I've gotten from any company that really didn't have any problem. Didn't break, didn't have to go back. I had one software upgrade the whole time. Normally they get a device and then it breaks and they have to send it back and then they send it back again and then software and this software is great and this software is terrible. And, that's the R&D issues. But this device was amazing right out of the box. So I'll probably do another one in a month or two. It was easy, and then people ask about pain. I have a pretty good pain threshold, especially it's good for a guy. I took zero pain meds um after this procedure. So when I had mine done, all I had was topical on my face. I had injections in my neck because I did a different laser there. I had topical on my face. Took I don't know 15-20 minutes to do the face, and then there's nothing to do overnight on it. And then I didn't even take a Tylenol. It was zero, zero, zero pain. And I shaved the next day and I worked out the next day. So, and you could definitely work out with this, no problem. The only kicker is don't go in the sun right away. While it's healing, you got to be careful not to go in the sun and then use sunblock conservatively. So just don't think you're going to get this done and go play golf or tennis in a week. If you want to work out inside or anything, no problem. Get on your treadmill the next day. I don't care. But you got to be careful, especially now that the weather got a little bit better and we might spend more time outside here.
Well, thank you so much again, Dr. Posner. Again, for everyone who attended the webinar, please schedule consultation, anything with all the providers at our office. Like Dr. Posner said, they're all very familiar with this machine, with the
Yeah.
lasers, great capable hands, and you'll also
Yeah.
be getting that complimentary neck treatment when you schedule your Tribrid. And we'll send out this recording again for anyone who wants to look over the information again, but we're here if you'd like to schedule your complimentary consultation. And any final thoughts, Dr. Posner, before we
No,
head out?
just anyone. If someone's going to one of our providers, really, all of our providers are really know how to use this laser. It's very easy laser to use. The trick with this laser is the settings. What settings are appropriate for that patient. But we have a super experienced team now, from our providers who do these treatments to the estheticians who take care of our patients, and our front desk who schedules everyone. So we have a really excellent team, and I'm going to call out Cheryl, our regional manager now, because she took over the med spa and the surgical side and our Fort Lauderdale office about 6 months ago, and she has this place running like a top. And we have really good providers, and the place runs super well. So thank you, Cheryl, for doing that. And she spends a lot of time, and all she deals with is broken things and problems.
One of the good ones at the helm.
Yeah.
Well, thank you so much
She
again,
got a
Dr.
flat tire.
Posner.
She broke her iPhone. Poor Cheryl.
The Tesla broke down,
No, I know.
Well, thank you so much again, Dr. Posner, and thank you everyone for attending and spending your evening with us. You'll get a follow-up email with our contact information for the office if you'd like to schedule an appointment with us. But other than that, thank you for hanging out with
Thank
us
you.
and have a great night.
And thanks for putting this together, Kat. Great job.
Thank you. Of course, my technical
Okay.
difficulties, but
No,
it
you did
worked out
fine.
great.
We rolled fine.
Thank you so much. Have a great night, everyone.
Everybody, bye-bye. Good night.
Bye.